The establishment of the Social Health Insurance Act of 2023 that has three funds under it: Primary Healthcare Fund, established under Section 20, the Social Health Insurance Fund, established under Section 25, and the Emergency, Chronic and Critical Illness Fund under Section 25, remain one of the radical reforms instituted by President William Ruto as one of the major drivers towards the attainment of his government's plan for universal healthcare. Besides the above bodies, the government also recruited 100,000 community health promoters across the country in a bid to shift healthcare from that of treatment to prevention.
Pale katika level 1, 2 and 3, dispensary na health center, kila Mkenya atapatiwa matibabu bila malipo yoyote. Na gharama ya matibabu katika level 1, 2 and 3, gharama yake italipiwa na serikali ya Kenya kupitia kwa ile fund ya primary health. Jambo la pili, pale katika dispensary yako ya nyumbani na katika health center yako ya nyumbani, sasa Wakenya watajumuishwa katika usimamizi wa ile facility. Nyinyi katika kijiji yenu, katika mtaa wenu, nyinyi mtakuwa na kamati ya kushughulikia mambo ya afya katika dispensary yenu, katika health center yenu. Ndio kama hakuna dawa, nyinyi wenyewe mtashughulika, mjue na mtupatie habari ya kwamba hakuna dawa katika hii hospitali, ndio Wakenya waweze kupata nafasi ya kupata afya katika mahali karibu pale nyumbani. Kwa sasa Wakenya wengi wanaenda kwenye hospitali yenye iko mbali kwa sababu ile dispensary iko hapo karibu, haina dawa, haina wauguzi na haina service.
Even so, the enacted regulations that seek to ensure equitable access to essential healthcare for all Kenyans
Solidarity forever
is one that has come under sharp criticism and even attracted a court injunction in implementation of its Social Health Insurance Fund after Health Cabinet Secretary Susan Nakhumicha issued a Gazette notice operationalizing it from November 21st.
We are implementing a per household payment system where a flat rate applies to everyone regardless of their income. Consider this, for example. Previously, an individual earning 10,000 had to pay Kenya shillings 500 for NHIF, a hefty 5% of their earnings. On the other hand, those with a salary of 100,000 or more contributed 1,700, a mere 1.7% of their income. This bizarre setup meant that low-income earners, mamambogas and bodabodas were effectively subsidizing high-income earners like myself. The Social Insurance Fund corrects this anomaly and makes sure that every citizen pays for health a percentage of their income, an equal percentage of their income, so that we can equalize the fortunes of every citizen with respect to access to health.
Several stakeholders in the health sector took issue with a number of sections of the Act, arguing it was set to disfranchise Kenyans.
We have not even taken consideration of those households that perhaps are not even living beyond, they can't even get a food on a daily basis. They can't afford even a 20 bob for their children for food. How then, when we put a moratorium that if you do not pay up front, for 1 year. Where do they get that fund? That mean, and that's where there was also the burden of disease. In looking at women, the burden of disease, particularly reproductive health diseases, they go to hospital many times. The out-of-pocket, we have not factored in.
The memorandums that were submitted by Kenya Medical Association, by the civil societies, by KMPDU, by FKE, by all these bodies, they were not looked into, and the advices, the proposals were not considered. And that's why we find this bill, as much as it comes out as a Social Health Insurance Act, it's more, and it seems, and it's quite clear that it's a vendor-driven venture.
They argue that the government's strategy to reform the country's health financing is one set to renege on the provisions of Article 43, Section 1A of the Constitution that guarantees each Kenyan citizen the right to access the highest attainable standard of health, including reproductive health. They also say that the Act as is vague and grants legislative roles to the Cabinet Secretary for Health. They warn that this move allows the Cabinet Secretary to come up with more regulations and clauses which are not part of the Act, contrary to the law. In its defense, the government says the Social Health Insurance Act that also repeals the National Health Insurance Fund, NHIF, will not be implemented immediately as deliberations on a transition framework were underway. These talks are to break down or give guidelines on specific regulations of the Act and be fine-tuned by January 2024. However, the High Court slammed brakes on its implementation until a case challenging its legality is heard. President Ruto has, however, maintained that the Act must be implemented if the health sector is to be reformed. But before this big health financing reform story, there were other big stories in the year in the health sector, and they all left an indelible mark in our lives. In the latest attempt by government to avail quality, affordable and accessible healthcare, President Ruto oversaw the launch of universal health coverage during the Mashujaa Day celebrations on 20th October, with a promise to ensure the realization of the health agenda that seemingly failed to take off under the previous regime.
Kila mwananchi atalipa kulingana na mapato yake. Na yule mwananchi ambaye hana uwezo, serikali ya Kenya itakulipia card ya hospitali. Kila Mkenya atakuwa na Social Insurance Fund card. Na wewe utaenda hospitali na utatumia hiyo card, either umejilipia mwenyewe ama umelipiwa na serikali, ili uweze kupata matibabu katika level 4, level 5 and level 6.
Also, barely weeks after it was hit by corruption scandal at its medical supplies authority cancer that has over the years been turned into a playground for corrupt individuals, the Ministry of Health came under scrutiny over integrity issues this year. A survey conducted by the Ethics and Anti-Corruption Commission, EACC, that sought to identify the nature, magnitude, cause and processes that are vulnerable to corruption and unethical conduct in procurement and financial management in the Kenya healthcare projects, exposed the plague that ails procurement and financial management systems in the sector. The EACC report indicated that favoritism dominated the tendering phase in the 3 phases of procurement. Bribery payments in form of cash, cost inflation, misappropriation of funds, among other forms of unethical practices in procurement, were also cited in the report. Even so, Health Cabinet Secretary Susan Nakumicha said the report provided an opportunity to drive crucial reforms and establish a transparent and accountable healthcare system that benefits Kenyans. 2023 will also be remembered as the year that the government initiated radical changes at the National Health Insurance Fund in an attempt to streamline operations at the National Health Insurer that has also over the years been rocked with corruption scandals.
What we are looking at today, Honorable Chair and members, are questions whether procedures were medically necessary.
An expose on how 8 private hospitals defrauded the institution was one of the major scandals that hit NHIF this year. Its management even admitted while appearing before the Senate Health Committee that some of its staff had colluded with private hospitals to defraud the institution.
Is NHIF punishing the facilities because of not complying? And I know you understand what that means in Kenyan language.
There was collusion between NHIF employees and fraudsters for this fraud of this magnitude to happen. And what NHIF did, some of which was in the media, was to take disciplinary action on a number of employees.
The defunct NHIF now seeks a refund of over 49 million shillings from the 8 facilities suspended over allegations of fraud and malpractice.
We wish to state that the allegations that many surgeries were done in a single day with one surgeon are false. Our hospital is well-equipped level 4 hospital with 2 modern theaters.
Almost all our cases are surgical. So either somebody has a problem with their brain, either somebody has a problem with their heart, or whichever medical condition they have, we'll send that to NHIF. And there's a team of professionals who will go through that. And there are cases when they approve, there are cases which they don't approve.
In what seems like a move to tame corruption allegations at the institution, a gazette noticed that operationalized the controversial Social Health Insurance Act of 2023 repealed NHIF and will now be known as Social Health Authority. It also introduces punitive measures for those found suspected of defrauding the insurance scheme through false statement. The measures include risk of being jailed for 5 years or paying a fine of 1 million shillings or both. Other scandals that rocked the sector include a Global Fund audit review report that poked holes into the tendering process for long-lasting insecticidal mosquito nets valued at 3.7 billion shillings at the Kenya Medical Supplies Authority Council. Queries to shed light into the bungled tender remained marred with blame games that pitted former officials at the agency against the Ministry of Health officials, including the Health Cabinet Secretary and former Principal Secretary for State Department, Peter Toom, who, in his defense, while appearing before the Senate Health Committee on Health, distanced himself from the scandal, stating he had no role in the tender process.
Is it still correct, one appears to say that officers within your department were not involved?
My department was not involved because according to the executive order, it is within that malaria program was under the ministry, the State Department for Public Health and Professional Standards.
My few days in office, I told the CEO, Kemsa, my friend, from today, I want to see pre-qualification through an information management system. And she told me, Madam CEO, the PPOA Act does not allow us to do it, and it is too costly to do it. I told her, I know somebody who will do it for free. And when the person went to visit, the CEO was not present. And therefore, we did not do any pre-qualification. But I'm glad that now we are going to do it.
In a twist of events, Global Fund terminated their earlier contract with KEMSA and awarded it to 2 companies that initially failed in KEMSA bid, sparking concerns among the Mandago-led committee.
What was unique with this procurement to the extent that Global Fund team didn't find it necessary to sit with KEMSA as usual to review and make a decision on the conclusion of this process?
Global Fund, if it finds that it no longer can rely on our procurement systems, has the right to say, no, we don't trust your process, we will do it.
As a result of the scandal, President William Ruto sacked Dr. Josephine Mburu as the Principal Secretary in the Ministry of Health's State Department for Public Health over the alleged impropriety. President Ruto also revoked the appointment of the chairperson of KEMSA and dissolved the entire board. Former KEMSA CEO Terry Ramadhani was also suspended amidst the changes at the institution and was later replaced by Dr. Andrew Mulwa. The suspended CEO would later land a government job after being appointed as the Deputy Ambassador to New Delhi, India. A report on the findings and recommendations of the scandal by the health committees is yet to be released. Similarly, in his maiden State of the Nation address, President William Ruto underscored progress made in curtailing supply chain-related challenges at KEMSA, stating that reforms instituted at the Drugs Authority have yielded a 20% improvement in its stocking rate.
As a result of this small intervention, KEMSA has improved its stocking rate from 40% to 60% in the last 5 months. And we are now targeting 80% by March next year.
The Ministry of Health also faced a backlash for backing its Labour counterpart over its proposed workforce migration policy that seeks to bar unemployed qualified health workers to seek employment abroad. Health Cabinet Secretary Susan Nakhumicha defended the plan, saying it was meant to shield the country from effects of migrating its workforce.
It takes quite a long time to train a specialized health worker. As a country, we do not want to spend time training them, then lose them to migration, then we do not have. Because for the new trainees that we have into the market, they will need time, they'll need resources to be trained to get to the level of a specialized health worker.
When senators questioned the rationale behind the plan, Susan Nakhumicha said,
as a country, we are not in a position to absorb all the trained health workers. So being alive to this fact then is to see how best do we work with both sides of being able to employ locally, but equally allowing those who need to migrate and get to work elsewhere to do so without the country suffering.
It was not all doom and gloom in the sector. It also had its fair share of positive stories that put Kenya's name in the Medical Hall of Fame. Kenya became the first country in sub-Saharan Africa to acquire CyberKnife, a fully robotic treatment that is painless, non-invasive, and delivers precise pulses of high radiation that targets tumors and abnormal tissues.
CyberKnife, the 6D, the robotic arm, moves with even the patient respiration. That is where we are able to treat tumors that are in areas that respiration is normal, like in lung cancer, pancreatic cancer. Also in the pelvic region, there's a lot of movement because of the bowel and all this. So because of that, 6D is able to follow every movement that is being done, up to sub-millimeter accuracy. In the brain, the structures are a bit more stagnant, they don't move as much, but the robotic arm is able to shoot beamlets from all the 6 dimensions. All the instructions come from here.
Kenya made this significant leap in tech and cancer treatment when it officially launched and even treated its first patient using the CyberKnife machine at the Kenyatta University Teaching, Referral and Research Hospital. For a very long time, chemotherapies, surgeries and radiotherapies have characterized the battle against cancer. However, significant advances in cancer care, like the introduction of CyberKnife that makes Kenya the second country after Egypt to install the stereotactic radiotherapy system, according to experts, will definitely transform treatment journey for thousands of patients diagnosed with cancers and tumors, both locally and across the region. This year also saw the Ministry of Health embark on a health facilities census that remains crucial in planning, policy formulation, and healthcare sector programming. The exercise launched in August targeted at least 15,000 health facilities across the country.
Of all the facilities in this country, only 7% are ready to provide services. And that only 6%